Right. Good evening, everyone. And it's an absolute pleasure to welcome you all for the April monthly webinar of the College of Palliative Medicine of Sri Lanka. So today's webinar is on the role of mindfulness and compassion in palliative care in Sri Lanka. So we are honored to have with us our distinguished speaker, Dr. Kumanga Andrahannadi. So first and foremost, let me introduce our speaker to you all. So Dr. Kumanga is a mindfulness trainer, a researcher, educator, and a consultant with nearly 20 years of experience in delivering mindfulness-based programs in the East and the West. Born in Sri Lanka at the age of 17, Dr. Kumanga left her home country in the pursuit of higher education and lived and worked in the UK for more than 20 years. During her master's degree, Kumanga rediscovered her passion for meditation and completed her PhD at the University of Dundee, Scotland, where she developed a novel mindfulness-based program entitled Mindfulness for Earth. With Kumanga's deep wish to share her knowledge with the people of Sri Lanka, she returned home and launched Calm Home in February 2025. Dr. Andrahannadi specializes in delivering the Mindfulness for Earth program, Mindfulness for Life program, and Mindfulness for Trauma Management and Conflict Resolution program and retreats. Dr. Andrahannadi has successfully delivered these programs for the public, private, and for government sectors, including to the educational sector, universities and schools, and police organizations and mental health sector and NHS, and government organizations in the UK, USA, Europe, Middle East, and internationally. She is an international mindfulness trainer certified under the prestigious Oxford Mindfulness Foundation, a partner of the University of Oxford, UK. Since October 2022, Dr. Andrahannadi is co-leading the Mindfulness, Spiritually and Planetary Health initiative headed by the Office of Global Affairs at University of Connecticut, USA. The initiative is run in partnership with the United Nations Environment Program, Faith and Earth and Calm. So with that, we warmly welcome Dr. Andrahannadi for today's webinar. Over to you.
Thank you so much, Sasha Prabha, and thank you, Lahini, for your kind invitation to speak this evening. And this is actually, palliative care is a subject that I've always been interested in since I started the PhD as well, because there was one caregiver who was in my program that I was when I delivered the pilot project. So I got the opportunity to work with care providers in NHS in Scotland. That was 20 years ago. So, and here I am. So this is really amazing to give back. This is why I came home. So again, thank you for the opportunity. Now, I asked a question earlier from Lahini. I don't know how experienced you are with mindfulness, so I'll start from the beginning to explain a little bit about my background, I guess, why I got into this field, and also the latest research in mindfulness in general, but also specifically to your field as well. And I think Sri Lanka stands in a position, very strong position, to do further research in mindfulness, because we are a Theravada Buddhist country and we have the teachings right here where we can access teachers to teach meditation and do various research projects. So this is where I would love to contribute in any way I can with the college as well. So please keep me in mind if you want to do further research around this field. So with that said, I thought I will start with a guided practice. How about that? Rather than me talking so much, I would like this to be an interactive session if possible. So if it's possible, I invite you to have your cameras on so I can see you and see maybe you're traveling. I don't know. Maybe you're joining in while you're traveling, so that's okay. Maybe you're having your dinner, if that's okay. But try and have your cameras on so I can see you and talk to you after the practice. So obviously, I was born here, but I lived in the West for over 21 years. And this is where I got my practices from my mother. My mother is a meditator, and I used to meditate next to her since I was about 3 years old. I had a real interest in the subject. And so then, obviously, we are taught meditation at a young age at schools. And also, we connect with the compassion meditation, Maitri Bhavana. So those are the little things, little droplets that I had, to fill my bucket when I left home. And then during a time that was very, very difficult in my life, it brought me back to my practice, why I should be practicing meditation. And my mom's advice straight away was, when I was stressed out, go and find a meditation class. And that's exactly what I did. So that journey, long time ago, led me to then pursue my higher education in mindfulness and developed the program that Sashi Pravat spoke about, Mindfulness for Earth, but also I've delivered mindfulness in different contexts as a result. So the meditation that we learn in Sri Lanka is obviously the foundation, but of course there are programs like mindfulness-based stress reduction, mindfulness-based cognitive therapy, mindfulness-based compassion meditation, and there are so many different programs that are out there now that has taken a spiritual or religious practice into the context of secular practice. So here we are then, it's for everybody, for anybody, and meditation is for everybody, in my opinion, as well, not just for Buddhists. And meditation does exist in all religions. So, and then what's really interesting is how the researchers took the practice in a secular sense and created this 8-week structure to see actual results, scientific results in the benefits of meditation, science of meditation. So this is where I'll do a practice called the 3-step breathing space for us to start the session. And this is a part of the mindfulness-based cognitive therapy curriculum developed by the Oxford Mindfulness Center, where I have my education from. So if we now come to a comfortable position, when we sit, sitting position is super important when we meditate. First thing is how we sit. That is when we learn if we can actually sit for a longer period of time or not. But at the same time, we give ourselves permission to adjust the position if we become uncomfortable during the practice. And another instruction I'd like to give you is, if you become uncomfortable during the practice for any reason, you're welcome to have your eyes open. So you can have a lowered gaze towards the floor, perhaps. And so your eyes are open, but you're listening to my guidance. And also, another instruction is that if you become uncomfortable, we can also come to or get in contact with our body as an anchor point. So for example, a little bit of anxiety arises during the practice. And then I connect with my body, for example, with my feet, sensations underneath my feet. Does it feel cool? Does it feel warm? What do I feel underneath my feet? So like that. So we have options if the practice is not working or if it becomes uncomfortable. So now let's come to that comfortable posture where we are not kind of leaning back, but we bring our back off the back of the chair. And so we have a straight spine, and we can place our hands facing up or downwards on our thighs. And then let's close our eyes, simply sitting together in a relaxed manner. And first thing what we can do is tune into the sounds in the space, whatever though they are. It could be maybe it's raining outside. Maybe you hear the rain. I hear the rain, gentle rain. So we awaken our sense of hearing. Could be the sound of the fan. There are a variety of sounds in the space, so we just open our sense of hearing to take in what's here. And now To start the three-step breathing space, I'll go step by step. The first step of the three-step breathing space is to check in with ourselves. How am I doing right now? So we check in with our mind first. How is my mind? So just asking the question. Usually we are really good at asking the question from someone else. How are you doing? But this time we ask the same question within. How am I doing? What kind of thoughts and feelings are here with me right now? So just checking in. And also another way to check in with our mind is simply not really focusing on the content rather than just observing the mind as a waterfall, river, or the ocean. And what do I mean by this? Waterfall refers to a very busy mind, like the continuous flow of thoughts. So if you feel like your mind is very busy, it's like that of a waterfall continuously pouring over the cliff. Does my mind feel like a waterfall? Okay. Or does my mind feel more like a river meandering through a valley? So there's more flow to our thoughts, more gentleness in the flow. Or does my mind feel like the ocean without waves? There's more calmness in the mind. The thoughts come and go. So these are the ways in we can check in with our mind. And now we're going to do the same with our body. How is my body doing right now? Asking the question from the body, how are you? How do I feel right now? Any pain, any physical tiredness I can feel in the upper back or lower back? Just becoming aware. We are not trying to create anything, rather becoming aware what's here for me in this moment. So checking in with the body with gentle awareness. And it's so normal for our mind to take it away and go into maybe something happened in the past, something to come in the future. That's very normal, but our practice is to bring our mind back to the present moment and to connect with my voice in the guidance and bring it back to the guidance, which is we are checking in with our body right now. Any kind of discomfort in the body, or also we are going to pay attention to any pleasant sensations. How do I feel around my legs? Do they feel more relaxed sitting this way? Because we've been rushing through the day perhaps, and we've given a break to our legs while we are seated for the next 45 minutes or so. So my legs feel more relaxed. Perhaps we can just gently roll our shoulders back, opening our heart, giving more space around the heart, upper body area. Just gently pushing the shoulders backwards that way, adjusting the position. And here, perhaps we can feel we can breathe better by just little adjustment like that. Preparing for step number 2 of the 3-step breathing space. Step number 2 is we are going to bring our focus of attention to our breath around the belly. So to do this, perhaps we can place our right hand on our lower abdomen. So placing our right palm on the tummy and just observing how the belly expands and how it falls away. It expands when the breath comes in, and it gently falls away when the breath leaves the body. So observing this, the breath coming in and out, through the contact of our hand with the belly, the lower abdomen area. Another thing we are doing here is by placing our palm around the lower abdomen, we are directing the breath to go all the way down to the lower abdomen, because usually our breath stays up here around the chest area, which is a cause for so many different issues, which I will talk about later. So we are directing the breath all the way to the lower abdomen where our hand is placed. Observing the breath flowing in and out. So now placing the hand down, but still observing the breath around the belly. So step number 2 is narrowing our focus of attention to our breath, sensations around the breath in the body. In this case, the lower abdomen. And now we are going to third step, we are going to widen our awareness to the entire body breathing. So although our breath, we feel it so much around our belly, when the breath comes in, our shoulders move, our legs move. So becoming aware that our entire body is actually breathing. So becoming, aware of the sensations around the body as a reason of our breathing. So one breath comes in, the entire body moves, body expands and body contracts. When the breath moves out through the nose or through the mouth. Also becoming aware of the contact points of our body with the chair. For example, buttocks. We are sitting on the chair, so our buttocks on the chair, our feet on the ground, our lower back against the back of the chair. Sensations of our clothes, contact with our skin. And again, becoming aware of the sounds in the room. So widening our awareness step by step to take in the sounds in the room one more time. And now gently moving our fingers and toes to conclude the practice, gently opening our eyes. Okay, so that was a very short practice of the 3-step breathing space. May I ask, if you managed to do this practice, maybe you don't need to put your camera on, but I would love to hear what was your experience in the practice. And also perhaps you can feel into how do you feel now, before and after the practice as well. So I'd love to hear.
I think I felt relaxed because a lot of things were going on. So it took some time to really settle, but I think after some time, yeah, felt really relaxed. Probably after at the end of the second step, and third, yeah.
Yeah, excellent. And you're so right. It's not, immediate that we go into this no thought mode or complete relaxation. It's a process. So great. So when we feel relaxed, what do you mean by you feel relaxed, may I ask?
Uh, I guess my mind was in a lot of places because I was looking at the participants. I had to see if it was recording properly. And so, like, my mind was really occupied with the multiple tasks at the same time, and my kids were running around. So, yeah. Uh, so,
And then
I
so,
could.
yeah, I guess the question is so, yeah, so all that was going on, but then later on you felt relaxed, right? So was it physical relaxation, the mind relaxed as well? How would you
I
describe
guess it's,
that
yeah,
moment?
I guess it's both.
Both. Ah,
Well, I guess it's both.
yeah, excellent. Good answer. Exactly. And so they both, first we can also relax the body, which affects the mind, but also when our mind relaxes, our body relaxes as well. So they are so connected. Yeah, great. Anyone else? I don't know if anybody's practicing, so so I can't see anything. So usually, what happens is, like I said, is it takes time and it takes an effort. And this is our life. What you said, kids running around, our day-to-day life is that. There's nothing really in still motion, is there? Our life is a moving river, and there are so many pieces coming together around this. So mindfulness practice is a key component, in my opinion. For me, it's the only way that we can come to the present moment and become aware. What am I doing right now? And how am I feeling? So become aware of my task in the moment. And then also to relax in my task in the moment. Because most of the time we go into what we call in mindfulness world autopilot mode. We are going to be talking about this tomorrow a lot. So when we are in the autopilot mode, as doctors, as you're doing your job, what happens is you're so used to this daily way of being, right? And it takes almost no effort sometimes to do what you're doing, but in the process you forget about yourself, your body, your emotional health, and basically most of the time what goes out of the window is self-care. And then what happens is this prolonged, basically, way of being like that is what leads to depression, physical illnesses, anxiety disorders, and so on. So this is why it's so important, especially in the field that you're in palliative care, that we need to check in with ourselves and to understand especially about our emotional health. So there's a study done, some time ago, in 2005, something like this, or 20 years ago, in the mindfulness. Mindfulness goes back to 1970s. The research actually now over 40 years. So initially, maybe you know about John Kabat-Zinn. Dr. John Kabat-Zinn came to Thailand, and he studied with monks in Thailand, forest monks. And then he realized, because he's a doctor, that he could actually help those who couldn't be helped otherwise. So he initially developed the mindfulness-based stress reduction program in the 1970s to help patients who were dealing with pain. So they were going through cancer, palliative care patients, basically. So this was really helpful for them to basically accept their condition. So these patients could not be helped otherwise. So he basically founded the stress reduction clinic for this particular reason, to help patients. And he basically also took yoga into the equation as well, and created something called mindful movement. So they're not like really, very difficult yoga postures, but rather paying attention to the movement in the moment, and very gentle exercises to help patients relieve their stress and accept, again, really getting into the body to accept how they're feeling. So this is we need to really understand what happens is when we are suffering. We all are suffering. Here I'll touch up the framework of the Four Noble Truths. So Lord Buddha, he said, there's suffering. We cannot, we all are suffering. But then he also said, what is the second one? Suffering, the causes of suffering. There's a reason why we are suffering. And then the third one is he said we can end this suffering. Fourth one is the path to the cessation of suffering, which is, mindfulness lies in that path, heart of the path. And then he gave the teachings on the Satipatthana Sutra, Mahasatipatthana Sutra, which is the discourse of mindfulness. And here we have to talk there, when we talk about palliative care, the subject, we have the suffering of the illness. And also, we have the suffering that we don't like this illness. There are two layers here. So there's a lot of suffering as a result. We are, very unwell. At the same time, we resist being unwell. So the level then goes into the level of trauma, and then re-traumatization when we are thinking about the trauma or the incident, something that happened, getting into the story of it. So that mind is reminding us of the same story over and over again. So, and then as caregivers, it's important to talk about the secondary trauma aspect. We are experiencing trauma of the patient as if it's our trauma. And then when we are in this situation over and over again, what happens is it's imprinting our mind, and then sometimes our mind can't differentiate between if this is real or not. So it goes into this mode of that secondary trauma mode. And so here, mindfulness becomes almost, no-brainer to practice. And so I worked a lot with, I would say, people who have gone through severe trauma. Work with Palestine, Israel, and Jordan. You can understand, the current situation in the country, in the region. So, and they have been practicing mindfulness for last now 1.5 years. When I went into the organization, they were not talking to each other. There was a huge conflict within the organization as a result of the war. But because of the practice, the power of the practice, they started to talk to each other, started to having mindful and compassionate conversations, and then they started to become mindful and compassionate, towards themselves for their own trauma, to understand others' trauma. We can only understand someone else's suffering when we look into our own suffering. So to look into our own suffering, we need a practice. To understand our suffering, we need a practice. So this is where these mindfulness-based models are so powerful, to first of all understand how my suffering works, to understand what we call meta-awareness, understanding our thought processes, to understand how our mind works, in order to understand my patient in front of me, in order to understand their family around them. So all of these levels, but it all starts with me, myself. So, and they're also interconnected, one rippling out to the other. So when I take care of myself, I can better take care of others, because I understand the suffering they are going through as well. So how does mindfulness fit into this, level of self-care first? And this is where, I spoke already about the stress reduction program. And there are so many practices. Body scan practice, maybe you've heard about it. You can search online. You can actually listen to recordings. There's so much out there now. The body scan practice, really, we begin to go into our body. Because what happens is, like Sashi Prabha said earlier, when we've had such a busy day, our lives are so busy, we live in our head most of the time. We are not here in the body, present in the body. So initially, when we talk about self-care starts with coming in here, coming home to our body. So this is what we did at the beginning. The three-step breathing space was to come in here and come to this present moment, coming into the body through the breath. So there are practices, breath awareness practices for that purpose. Then there are practices like the body scan. Then there are practices where we work with different senses. So for example, drinking, we practice mindfulness through a water glass or with tea, for example. So all of these practices have been integrated into mindfulness-based 8-week programs. They don't, like I said, there are different programs with different kind of focus points. And then MBCT, so MBSR was for pain, to deal with pain. MBCT, mindfulness-based cognitive therapy. So the researchers at the time, they wanted to develop something very specifically target patients with depression. And they looked at, especially for relapses, okay? They wanted to see if they introduced mindfulness, if they could stop the relapses. And it did. So there's a lot of really strong research that shows now that depression can be treated through mindfulness. And the cognitive therapy is the CBT integrated into mindfulness. And then they developed it a little bit more, something called Mindfulness for Life, which is for the general public as well. So those are some programs out there, and then there are programs that also incorporates compassion, more compassion element. So Mindfulness for Life program also incorporates the compassion element, but I really believe, because as Buddhist, the compassion element is such an important element in the practice. To understand what is compassion is really important. So again, as carers, when you look after such critical patients, for example, how do we practice compassion in these scenarios? How do we practice compassion with families who are grieving, who are going through, serious period of their lives through their family member? So this is a question mark I will leave for the moment. Do you have any questions so far? Or am I making sense? Let me ask. Yeah? Okay, good. So yeah, the compassion element, and I also spoke a little bit about, I'll come back to now the trauma element. Now, there's a practice called rain practice, because the rain started when we started the session. That reminded me to talk a little bit about, I didn't plan to do this, but you can also search on the internet again for the rain practice, RAIN. And this very specifically focus on the trauma aspect. And so I'm giving you little hints where you can do some research. This is for your own practice, okay, not to give it to someone else, but you can do research and see what, you might, because some practices work for some people, and then some practices might work better for others. This is why it's important to experience a wide range of practices. Then we can choose what's best for us and keep practicing that until we become better at it. So the RAIN practice, I'll break the letters down, okay? R stands for recognizing what's here. Recognizing what's here for me in the mind. And then A refers to allowing. Because most of the time, when we are going through trauma or when we are going through a very stressful period of our lives or stressful scenario that happens in our lives, we don't want to face it. We rather push it away. And this is again that suffering on top of suffering layer we are talking about, that resistance level, okay? So, but instead of resisting, we are allowing this experience to be there. And then I refers to investigating how this emotional self reflects within my body. I'll do this RAIN practice towards the end of our session so you can experience what I'm talking about here. Most of the time we are not aware this, mental, emotional trauma, emotional sadness or physical, it actually, we can find places in our body that reacts as a result. So investigation comes back to taking that U-turn and coming back here and checking, okay, can I feel anything relating to this scenario in my body? And then N stands for nurturing. And here we do a compassion practice. So after we recognize what's here, and then A for allowing this to be there, I investigating, can I feel this in my body, to then going into compassion practice, or it could be 3-step breathing space practice, anything that will nourish me in this moment. So this RAIN practice is a beautiful meditation practice we can do when we feel overwhelmed by something, when as carers, as when we come in contact with a difficult problem. We can take a little break. Maybe we can even go to the loo for like 5 minutes, taking a little break and then checking in through the RAIN practice. So it can be a lifesaver, literally, the RAIN practice. And it's been integrated in different fields, this methodology. So mindfulness has been tested in all sorts of different fields. And I think, so when I was reading the literature, Lihini, what's something really missing here? So we are talking about the self-care element, right? But what's missing here is the connection between the carer and the patient. The bond that we are, the literature doesn't really give us too much, information into, does this bond become stronger? Do I become a better healthcare provider as a result? There's some research out there, but not strong evidence at the moment. And also, how do I cultivate trust between me and the patient? So basically this direct contact, the relationship between the carer and the patient is yet to be examined. And which is a really important element, in my opinion. Integrating, this is the whole point we are trying to do this, is to actually not just to reduce stress, but also to then, as an output, how does this affect, how does it benefit in my professional life, to the extent that it reaches the person in front of me. It lands in them in a compassionate manner. So this is my main interest. Actually, it has always been my main interest in the research field. As a result, is why I developed the Mindfulness for Earth program. It's because, in mindfulness, now I'll come to this a little bit, there are 3 aspects that the research has been really, prominent on. Neuroplasticity, maybe you understand this already, and where we can actually rewire our brain. Before mindfulness research, we did not think that we could actually change the brain structure like this. So we can actually rewire our brain through meditation, but this is why this 8-week structure is super important. There's time for this rewiring to take place. And then that's one thing. And then the second is epigenetics, where we can actually, influence the gene expression. So there are studies to healthier aging, for example, through long-term mindfulness training. And this is very prominent in Tibetan Buddhist masters. You can look into this research around Matthew Ricard, for example. I'm sure you know about him, Dr. Matthew Ricard, and then Venerable Mingyur Rinpoche. Holiness Dalai Lama has been tested. So various Buddhist masters have gone through various research under Dr. Richard Davidson's laboratory in America. And there is strong evidence to what happens for long-term practice. And they can see real differences in these long-term serious meditators versus us, basically. Changes in gray matter and so on. And and then the third one is where I'm coming from, where this carer, the bond, the trust, the relationship between the carer and the patient are what we call in scientific words the innate capacities. So these innate capacities is this is where the compassion, cultivating awareness, empathy, trust, bond, acceptance, all of that comes, equanimity, all of those things come as our inherent. We already have these capacities, but through mindfulness, long-term practice, we can recognize we have these and we can cultivate them. So we can naturally, these qualities rise up to the need of the moment. So this is a really important, findings, I would say, in the mindfulness field. This is where I targeted the Mindfulness for Earth program, and we found out that, really evident that these beautiful qualities can be cultivated and they are long-term. So, once these new neural pathways are cultivated through the practice, these qualities become stronger and stronger. And as a result, our mind wandering becomes less, and we are able to distance ourselves a little bit from our mind wandering. And instead, these qualities come into action to help others. So this is the power of mindfulness practice in a nutshell, I would say. So I'm going to stop talking here because I know we have 15 minutes. I hope this was useful. And then maybe last 5 minutes, let's have a chat for 10 minutes. And I'll do the RAIN practice like we did the 3-step breathing space at the beginning. We'll conclude with the RAIN practice. How about that? Yeah.
Yeah, that sounds good. Thanks, Kumanga.
Brilliant.
I was just thinking, it's not really a question, but I was just thinking about how beneficial it would be for patients, because I think a lot of patients do carry a sense of guilt for that they've got, whatever illness they've got. They often blame themselves and they think it's because of something they've done in a past life or this life or whatever. And so people, they sort of come to this state of the so-called acceptance, but it's more like a punishment for themselves. And then carers as well, obviously they suffer a lot, like the family caregivers, and helping or giving them something that they can do, in their own homes or at any time without having to, it's so hard to find counselors and all these things. It would be really beneficial for them to have find a way to deal with their own grief while they're caring for the patient, and then once the patient has died as well. So yeah, I think there's lots of ways we can incorporate things.
Yeah, absolutely. And this is something that, I'm experiencing this at the moment with my auntie who is bipolar. And there is absolutely nothing in Sri Lanka that actually support the family in any way. So the family, they have to understand themselves to how to deal with the situation. I'm just talking in my auntie's sense, right? And so there's no support system. And like you said, how many can afford to go see a psychologist, for example, or a counselor? It's not really something that we have available here. In the UK, there's a lot of support because I was there for a long time. However, the need is so great now. The system is broken in the UK as well, completely broken. So people are suffering in so many levels, like you said. Yeah.
So I was thinking in the perspective of healthcare providers, because healthcare providers in the field of palliative care, you don't, it's a lot of strain for them as well, mentally as well as physically, because your patients are not going to get better in the sense of treatment wise. So uh,
Right.
when you look after a patient for a certain amount of time, there's kind of bonding and kind of, you have that sense of uh, that connection with the patients and their families. And then I think you also have a lot of that strain while caring for those patients. So I think this is something that you can use, because I especially, even though I'm not a treating physician, uh, I also felt like when I was relaxing, like how tense my body was, which I didn't notice earlier. Like
Yes.
it like when I relaxed and I realized like it didn't like register in my mind like it was tense for such a long time, because I guess, as you said, it's autopilot, so we are quite used to just functioning and dropping from one subject to another and another, and in the end, in between, we quite forget to really care for ourselves. I think for service providers, I think it's a quite an important area for self-care, and I think this has a really big component in it.
Yeah, I think you hit the spot there. I think this is the starting point for Sri Lanka, is the self-care for the service providers. I think this is because when the service providers are um, kind of like the agents too, then you can also spread the word. You can tell the families, maybe you can look into this. Online you can find, like the way I was explaining to you, you can give tools to your the families who are going through this with the patient, for example. And from what you said, Sachprabha, is now when, as a direct physician, for example, when you're working with a patient, like you said, that bond that you create over time. And then this is the practice becomes so important, because here then we are begin to see, actually, while we care for them, we can also have a little bit of a distance to take care of ourselves, and to address my needs for my own family, for example. And to because most of the time we are not aware of when I remember one doctor, when I went into a webinar, they were talking about, so one other thing happens is, in this field, is you see a patient and sometimes you start to think, oh, what if this happens to my family? We go into our thinking mode. This could happen to my family, this could happen to my wife, this could happen to my child, and so on. And then as a result, this is that secondary trauma I'm talking about. This could become a reality in the mind, which hasn't even happened. So this is where the mindfulness practice really is so important, to look after ourselves as caregivers.
And
Hello.
I think, yeah, um, I think,
Hello.
yeah, yes, Dr. Ananta.
Yes, since you talk about some research regarding mindfulness, so have you heard about the length of telomeres in the genetics I'm talking about, the length of telomeres as well as the mindfulness? Have you heard about those sort of researchers?
I have not. Sorry.
Uh, yeah, it's like the telomeres, of course, is a covering the cap of the every like gene. So then they have some kind of a protection. If you have kind of prolong or some kind of long term meditation or some kind of mindfulness, the length, with the aging process, the length becomes shorter and shorter. And with the practice of mindfulness or meditation, so the length become like getting increased. So sort of because of that, less exposure to a lot of external things which can cause some diseases, even for the cancers. So that's, of course, is a very, there are a lot of researchers. it's kind of, I think it's very important to know as clinician, I'm a practicing clinician, as
Yeah.
well as if you know your mind, we can understand somebody else's mind. All the diseases, they have the sort of emotional component. So then if you can find out the emotional component, definitely it's very easy to sort of get the full compliance to the disease as with the management plan, as well as to treat the patient, I mean, very successfully, I suppose. So that is the why I think we need to, as clinician, we have to practice mindfulness. It's very good.
Yeah, absolutely. And I'm actually going to look into what you just said, and I'll try to see if there are particular studies
Yeah.
around.
Yeah,
And
I mean, it was there like even 2010, 2009. There are a lot of even Canadian research also
yeah,
there. Yeah,
see,
okay.
I did a lot of like review. I had to do the
Mm,
review. I'm sure I've done it like so many years ago.
mm, mm,
So
mm,
I'll
mm.
look into this and I'll try to share. And it is really important to when as especially when we want to also introduce this to doctors, clinicians like
Yeah.
yourself, to give the facts and the current research in the field, right? So that
Yes.
people understand actually there's strong evidence that we should be doing this and we should be encouraging our fellow clinicians, fellow doctors to do this, but also introduce this to the patients themselves as well. So, like you said, this direct connection between, like, where does cancer begin? you know so these are good questions to ask ourselves and to understand the same way that these physical manifestations happen, can we reverse this as well? Yeah, that's a question to keep in mind as we talk about this subject.
Any more questions from the audience? Yeah, I think someone sent a link to a paper, I think.
Excellent.
Yeah.
Yeah, there you go.
Mhm. I think one of the key things is for you to introduce the concept of mindfulness for your patients, you have to be doing it yourself. I think that's something what I got from your presentation is that you have.
Completely. Yeah, this is exactly why I spoke about self-care. And also, not just that, to talk about mindfulness, we have to practice it, right? We have to feel the benefits within, and we need to have a practice to talk about something. We need to have experience to talk about something. Without that, we can't really talk about it. This is like also, the research is great, but at the same time, when this is internal experience, it's a different way we can communicate also to others. Not just the theoretical understanding, but actually lived experience of a practice that we can share with others. And as a practitioner, I've had so many different illnesses, and with the practice, I was able to deal with this better, and to be able to accept what I had, to be able to deal with stress, the pain, and sometimes, like, I see everyone around me are more stressed than me, because for me it's something else happening in my body, but it's also there's impermanence in everything. There's a possibility, even though I have a really critical illness, there's a possibility that I could also get better. So it can also bring sense of hope actually into our lives. This is something that this is why I encourage, as practitioners, as clinicians, for you to introduce such a practice and to experience it yourself, the benefits of it, and then to share in the wider community. Yeah.
Hello, I'm Samadhi here.
Hi, Dr. Samadhi.
Yeah, I have a few things to, ask. Number one, now we are talking about mindfulness in palliative care practice.
Yes.
So in palliative care, as we all know, we are dealing with patients who are terminally ill or life-limiting illnesses. So
Right.
we are talking about end-of-life care or terminal care. So with lot of suffering or lot of unfinished businesses. So how do you feel to get the mindfulness practice to those patients? So have you ever come across some validated or techniques where you can introduce particularly for these patients, and how now you mentioned many examples in Western world,
Yeah.
so how all these things culturally accepted to our
Mm.
part of the world? So you have any thoughts?
Yeah, that's a really great question. No one has asked me this so far here. So, because I am a Buddhist, is why I
Yeah,
was interested in meditation when I went to the West, right?
yeah.
So, why I took the practice in the West initially, and then I, got really dragged into. I was really interested in the practice myself. So, when you actually do the practice, you realize it is Buddha's teachings that is actually in the system. In that, all the practices are part of Satipatthana. When you look at Satipatthana, I don't know if you've studied the sutra,
Mm-hmm.
but there's a direct connection, doctor, between the compassion practices that are in the 8-week programs that are taught as a secular model. So this
Mm-hmm.
is exactly what I did in my PhD. I
Yeah,
actually took this connection between the East and the West. That was
yeah.
my intention, okay? Because most of the time, for me, the issue was it's okay to make it secular, but you need to acknowledge where it comes from and to,
Yes.
connect it so that people can also benefit, a spiritual benefit through that as well. So I think for us as Sri Lankans who are experienced in this already growing up, it makes real sense when we begin to look at the framework and
Mm-hmm.
you can understand where it comes from very easily. Let me put it
Yeah,
like that. And
yeah.
then to your question about introducing this to, those patients who are dying, who are,
Mm-hmm.
maybe they don't know when they're going to die. They've been given few days, few months.
Mm-hmm.
I have personal experience of such patients. So I work with the police, London Met Police, for the last 5 years, 6 years, with the
Yeah.
counterterrorism department. And
Mm-hmm.
I first started to work with the trauma aspect. And
Mm-hmm.
there are so many, officers who have been traumatized through their job, and then who are going through terminal illness like cancer, for example. And
Mm-hmm.
there was a lady, Gillian, and I can give so many examples, but I'll give you one example.
Yeah.
She was given 3 months to live when she started. I had no clue because about 25 people come onto the program, so people don't tell their entire stories right when they come to the
Mm-hmm.
program. But later on, I realized that she's terminally ill. She only had 3 months, to live, and
Mm-hmm.
after she discovered the practice, because I spoke about Buddhism and where I get my practice from, she went and joined a group in her neighborhood and
Mm-hmm.
she started to practice the practice. And the
Mm-hmm.
program Dr. I developed, we engage with nature as a meditative tool, with
Yeah.
water, with the elements, natural elements. And I
Mm.
was so interested to reconnect these dots between our connection, our mental health, our physical health is really going down the drain because we are not anymore interacting with the natural environment. So there's a lot of research that are benefits for physiological and psychological benefits with the environment. So Gillian, I encourage her to go outdoors, to spend time outdoors. So she lived 2 years after
Mm-hmm.
since. So this is a direct, very personal experience, and she was a
Mm.
very close friend, okay? And
Yeah.
the other gentleman, brain injury, really, and he basically stabbed himself to kill himself. And complete mental health breakdown. He was the one who actually, because of him, they changed policies within the Met Police.
Yeah.
Again, he came to the sessions just when he was coming out of his care in the
Mm-hmm.
community, and he's been practicing meditation for the last 5 years.
Mm-hmm.
And so, I have really close experiences like this, and for me I see that it helps these patients so much, improves their quality of life, and gives them like that sense of well-being in the midst of their illness, basically.
Mm-hmm. Thank you so much for sharing your experiences.
Yeah,
And
no.
next one.
Yeah.
Now, what about now? You mentioned about your personal experience about your aunt who is bipolar, and you said Sri Lanka about something, but in the Ministry of Health, the Department of Mental Health, we are trying our level best to establish some clinics, the support system. So it's yet to come, but we have some support system also. But anyway, now my second question is, how do you think to integrate this mindfulness to the mentally sick patients who are palliative? Now, for
Yeah.
example, now we are now, sometimes we don't have clue to take care of, severely dementic patient who
Right.
needs palliative care or some severe mental disorders. Do you think mindfulness practice will give some hope or help for these kind of patients?
Unfortunately, not at that stage. The current research actually does not support that, doctor. What it supports is
Uh-huh.
early stages. It
Mm-hmm.
can actually help, but when it is gone to that extent, and actually, there are, mindfulness is great, but not in all scenarios.
Mm-hmm.
It has to be done very carefully. Okay,
Mm-hmm.
that's why a lot of training is needed. When we are giving this practice, we are dealing with somebody's mental health, basically.
Yeah, yeah, yeah.
So
Yeah,
this,
yeah, I agreed. I agreed. Now,
yeah,
in the Western world, with the research findings, maybe there are not. But I just wanted to. Have you read the Pansiya Panas Jataka book?
some of it, not all of it.
Some of it. So there are 542 stories. All are about mental illnesses. All are about mental illnesses. 33 out of 33, that is about depression. Out of 26, this is bipolar. So I can name many mental disorders and how the Jataka stories began. But again, the mindfulness practice, the teacher or a conductor should be mindful, like you said very carefully and very nicely. The caregiver's practice or healthcare provider should be mindful rather than anyone to give the proper compassionate care to the patient. I
Yeah,
agree with you. I agree with you. So now if you take Patachara or Kisagotami, the scenarios, they are severely depressed. They were, suicidal. But
right.
at the cognitive the things and how the behavior changed. So there are many research findings, maybe not published as Westerners. But in our part of the world, particularly with the Buddha's teaching, there are many. So those are not published yet. Maybe it's our duty, your duty, to get all these roots, because we have roots,
Yeah, we do.
and and
It's a
and and,
try.
pub- and publish. As the
Yeah.
College of Palliative Medicine of Sri Lanka, I can remember when we publish our booklets, Dr. Manudi Vidanapathirana, uh,
Okay.
she wrote a booklet. I was supervising that, about how to take care of caregivers. It's really good. There was one part she wrote about the mindfulness practice. So college already taken few steps to, to practice this mindfulness. So anyway, this session is really good. I congratulate you and
Thank you.
Lihini also for all the coordinating and finding you. And it's really, really important. And I wish we can continue to work with this project. And finally, I'll tell I have many vast experience with meditating monks and lay people. During my PhD in 2011, I was doing the Sotapanna in as my PhD. So there I had interviews in 8 countries. The people who practice mindfully up to the north, the top. And
Right.
you know what I got? Most of them they forget about their physical ailments. They are not bothered about that. You know, they are mentally very fit. They
Yes.
just forget. They just forget. And you know, the last thing I want to mention is day-to-day practice. You mentioned very correctly which is very relevant to palliative practice. That word is suffering.
Yeah.
So there is no medicine in Western or Eastern or whatever the developed medical thing to the suffering unless you have the practice of mindfulness. So mindfulness is that is why the palliative care, palliative medicine is so fascinating. So we are talking about the get rid of suffering, not the pain. It's a holistic approach.
Yes.
So it's really wonderful. Congratulations. Thank you so much.
Thank you so very much. It's really interesting to hear and absorb what you just said. I'm just really grateful to Lehini for bringing me in to your family in the college. So please, I would love to get involved. And I think as Sri Lanka, we have a responsibility to give to the mindfulness field, into the research and what's out there. So I really encourage you to put into literature what you're talking about, Doctor, and because I think the West will benefit. They're always, looking for collaborations, maybe. So I'm connected to UConn, University of Connecticut in America. So maybe there could be a joint study that we could. There are so many things we can look at. So I'm based here in Sri Lanka now. So please keep me in mind for anything that you would like to test out, or if you want me to come to the college and do actually a in-person session with the clinicians or caregivers, whoever that may be. So yeah, I'm very excited to have connected with everybody today. Thank you.
So we can get your number through Lihini, no?
Yes, yeah, absolutely.
Okay.
Yeah. Thank you.
So, thank you so much. So, on behalf of the College of Palliative Medicine of Sri Lanka, I wish to thank our speaker, Dr. Kumanga Andrahannadi, for your presentation and on mindfulness, compassion in palliative care in Sri Lanka, and how we all can benefit, and especially with your sharing your expertise as well as your experience in the field of mindfulness. And I think the practical session that you had especially was helpful in allowing us to engage with the concept and in a meaningful way. So thank you once again. And I wish to thank all the participants as well who was with us. And we will be sharing the recording of this session. And thank you for being with us. And thank you once again, Dr. Kumanga. Thank you so much and good night.
Good night. Thank you so very much.
Thank you.